You've probably never had to think about this before, but suddenly you do. The phone rings. It's a number you don't recognize, but it's got the local hospital's area code. You answer, and it's a doctor, or maybe a nurse practitioner. They're using these super reassuring words, medically stable and progressing well. But then they drop a bomb. Welcome to this explainer. Today we're going to walk through exactly how to safely navigate the next 48 hours in California right after you receive that terrifying phone call.
We're planning for discharge tomorrow. Your heart just totally sinks. Tomorrow? Wait, you were just at the hospital. Your mom or dad is still weak? They are confused, maybe barely able to sit up on their own? The idea of them walking through their own front door, let alone trying to manage complex medications and meals? It feels entirely impossible. You look around your kitchen, maybe you see a huge pile of mail on the counter, and you just feel this absolute wave of panic. Because right now, the medical system has decided that their crisis is over. But for you and your family, the crisis is literally just beginning.
Let's just validate this feeling right off the bat. They are not ready, and you are not ready. It is completely normal to feel totally overwhelmed in this exact moment. But I promise you, by the end of this explainer, the goal is to empower you with the exact tools, scripts, and strategies you need right now to handle this. Let's look at how to use your rights and leverage the system.
So what do you do next? How do we transition from that feeling of sheer panic to total empowerment? How do you, as an adult child, immediately step up to guide your parents' safe transition out of the hospital?
Okay, let's dive into this. Here is our step-by-step roadmap to help you regain control. 1. Decoding the discharge plan. 2. Your right to say no. 3. Navigating next care options. 4. The discharge date checklist. And 5. Your urgent action plan.
Section 1. Decoding the discharge plan. Understanding the blueprint.
So this entire formal federal process is overseen by the Centers for Medicare and Medicaid Services, and it is designed specifically to prevent quick hospital readmissions. At the very center of it all is one key person, the discharge planner. This is usually a hospital social worker or a nurse case manager. Let me be clear, this person is your single most important point of contact. They are the absolute center of the collaborative discharge process. They're talking to doctors about medical needs, insurance companies about coverage, and most importantly, they're talking to you about what is actually realistic.
A good discharge plan is basically a comprehensive roadmap, and legally it has to include certain things. Where exactly will your parent go? What medical care and follow-up appointments are officially booked? What's the detailed medication list? What durable medical equipment, or DME, stuff like a hospital bed or oxygen, is required? What home help or physical therapy is lined up? And who is the emergency contact? Listen, the hospital cannot create this complex document in a vacuum. They absolutely need your family's input to make it work.
And this brilliantly illustrates why your perspective is just so critical. The hospital's view is really limited. They see your parent for a few days tucked into a bed in this highly artificial, totally controlled environment. But your view as the advocate, you know the whole person. You know how steep the stairs are at their house. You know their fears. You know their true baseline capabilities. You are the ultimate expert here. Think of yourself as the essential brakes to the speeding hospital machine. Section 2. Your right to say no. Exercising your legal right to appeal. Here's your ultimate superpower. If you don't think your parent is safe to go home, you have the legal right to say so. It's not complaining. It actually triggers a formal check and balance. Here's the highly manageable, chronological path for Medicare patients in California to do this. Step 1. Find the important message from Medicare form you were given when they were admitted. Step 2. Call the organization listed on it. In California, that's Levanta. Step 3. Tell them you want to file an appeal. So the crucial point is, the moment that call to Levanta happens, everything stops. The hospital cannot discharge your parent, and they absolutely cannot charge you for extra days while the appeal is under review. You have just secured an immediate stay. Levanta will take about 24 to 48 hours to review the records. And you know what? Even if you ultimately lose the appeal, you've just bought yourself a couple of crucial free days to reassess safety and get more support in place.
Section 3. Navigating next care options. Where to go when home isn't an option.
When a patient doesn't need intensive hospital care anymore, but they aren't quite ready for home, there are 3 main post-hospital paths the discharge planner should give you. First up is a skilled nursing facility, or SNF. This is for short-term rehabilitation, like physical therapy, to get them strong enough to eventually go home, and it's typically covered by Medicare. Second is home with home health. This is where your parent goes home, but skilled professionals, like registered nurses or occupational therapists, actually come to them. Finally, we have IHSS, which is non-medical daily help for things like bathing and making meals. Notice the difference here? IHSS is uniquely covered by Medi-Cal, which brings us to a really critical point.
If your parent has Medi-Cal in California, you have access to some powerful long-term support that standard Medicare simply does not offer. Programs like In-Home Supportive Services or IHSS are absolute lifelines. But here is the vital takeaway. You must start the IHSS application with the hospital social worker before discharge. Do not wait until you get home or you're going to face agonizingly long wait times. Also, make sure to ask about CalAIM services, which can actually provide home modifications and medically tailored meals.
Section 4. The Discharge Day Checklist. Don't let them rush you. Look, discharge day is going to be chaotic. But before walking out, it is absolutely critical to do a medication reconciliation. The hospital might have started new meds, stopped old ones, or completely changed dosages. Do not just take the printed sheet and leave. Sit down with the nurse and go line by line. Ask them, what is this medication specifically for? What side effects do I really need to watch for? And are these entirely new prescriptions or just refills of what they already take? You need a crystal clear understanding of their exact pill regimen.
And here is a tasteful, honestly surprising tip. Ask about a meds-to-beds program. A lot of hospitals actually have their own pharmacy fill all the new prescriptions and deliver them directly to your parent's hospital bed right before you leave. This lets you completely skip that brutally stressful pharmacy stop when you're trying to drive a frail, exhausted parent home.
Now, what's really interesting about this checklist is that the return on investment is massive. Taking just 30 extra minutes in the hospital room to confirm these final logistics will literally save you hours of panic later. Confirm those follow-up appointments are actually booked. Get the exact dates and times. Ensure the durable medical equipment is ordered and get the supply company's direct phone number. Make sure home health is officially scheduled. And finally, get a direct phone number for a nurse on that floor for the next 24 to 48 hours, not just the main hospital switchboard.
Section 5. Your Urgent Action Plan. What to do this week.
All right, let's bring it all together into a tactical battle plan. Here is your strict checklist. 1. Find your person. Save the discharge planner's direct extension in your phone right now. 2. Request a care conference. And when you speak, use I statements. Say, I am concerned about Dad's safety rather than pointing fingers. 3. Find that important message from Medicare form so you have Levanta's number ready to go. 4. Start a notebook. When you are totally overwhelmed, your memory will fail you. That notebook is your new brain. And 5. Use the 48-hour playbook checklists we've just outlined.
Remember, the hospital system is a machine, and it's built for sheer efficiency. It is designed to move patients fast. But your job as a caregiver and advocate, your job is to gently apply the brakes. You have to be the one to look at the medical team and ask, is this fast or is this safe? You're not being difficult at all. You are being a deeply responsible advocate for your parents' safety. Because the truth is, the moment of discharge isn't the end of the journey. It's literally just the beginning. The real work starts the second you walk through that front door. And what happens when the home health nurse leaves? The house gets quiet, and you realize the person who came home is fundamentally different from the one who went in. What do you do when dementia comes home? Well, that is exactly what we're going to tackle in our next explainer. Until then, grab your notebook, trust your gut, and remember, you've absolutely got this.